Imagine this. You're sitting in your favorite armchair, sipping your morning tea. Your grandchild runs in, laughing, holding up a crayon drawing they made just for you. You feel alert, steady, and grateful because you know you're taking good care of your health. You have the energy to enjoy these moments. The thought of a sudden health crisis, like a stroke, feels far away, almost unthinkable. But here's something most people don't realize. For millions of older adults, the risk of a stroke isn't only about diet, blood pressure, or exercise. It can actually be hiding in something you take every single day, your medications. Why this matters? If you're over 60, there's a good chance you take at least one prescription or over-the-counter medication daily. Many seniors take 5 or more. These medications can be life-saving, controlling blood pressure, managing pain, or treating chronic illness. But some of the most commonly prescribed drugs can quietly raise your risk of blood clots, cause dangerous heart rhythm changes, or damage blood vessels, all of which can lead to a stroke. And often, neither you nor your doctor may connect the dots until it's too late. Have you ever wondered if your medications might be doing more harm than good? Type yes or no in the comments, and if you're comfortable, share which medication you're most curious about. Understanding stroke risk for medications. Not everyone who takes these medications will have a stroke. Stopping them suddenly can be dangerous. The key is balance, knowing the risks, watching for warning signs, and discussing them with your healthcare provider. Quick refresher. What is a stroke? A stroke happens when blood flow to part of the brain is blocked or a blood vessel bursts. Ischemic stroke caused by a clot blocking a vessel. Hemorrhagic stroke caused by bleeding in the brain. Medications can raise risk by increasing clot formation or damaging blood vessels and raising blood pressure. Number 1. Certain hormone replacement therapies, also known as HRT. Why they're common. Prescribed to postmenopausal women for symptoms like hot flashes, night sweats, bone loss, and to some men for testosterone replacement. Research shows certain oral estrogen or estrogen plus progestin pills increase ischemic stroke risk. The Women's Health Initiative trial found women on combined therapy had a 41% higher stroke risk. Estrogen can increase clotting factors, raise triglycerides, and alter vessel function. Women over 60 with high blood pressure, diabetes, or smoking history face greater danger. Safety tips. Consider transdermal patches instead of pills. Use the lowest dose for the shortest time. Know your personal risk factors. Control blood pressure, maintain a healthy weight, and exercise. Number 2, certain NSAIDs, or non-steroidal anti-inflammatory drugs. Why they're common. Used for arthritis, back pain, and joint stiffness. Drugs like ibuprofen, naproxen, and diclofenac. Stroke connection. High doses or long-term use can raise blood pressure, reduce kidney function, and harm blood vessels. The BMJ found diclofenac linked to a 40% higher stroke risk. Even some of the safer NSAIDs show increased risk in older adults. Why seniors are vulnerable. Reduced kidney efficiency, existing arterial stiffness. NSAIDs can blunt blood pressure meds. Safety tips. Use the lowest effective dose for the shortest time. Alternate with non-drug methods, warm compresses, stretching, physiotherapy. Monitor blood pressure. Number 3, certain antiarrhythmic and antipsychotic drugs. Why they're prescribed. Antiarrhythmics control abnormal heart rhythms like atrial fibrillation. Antipsychotics used for mood disorders, dementia agitation, or severe anxiety. Some antiarrhythmics can cause dangerous rhythm changes, reducing blood flow and increasing clot risk. Some antipsychotics double stroke risk in elderly patients, especially those with dementia. Higher risk in seniors. Slower metabolism, drugs stay in the system longer, multiple health risk factors. Polypharmacy increases interaction dangers. Safety tips. Regular ECG monitoring for antiarrhythmics. Weigh benefits versus risks for antipsychotics. Watch for sudden balance, speech, or vision changes. Keep a current medication list for every appointment. Did any of these 3 medications surprise you? Write "surprised" in the comments if one caught you off guard. We've only scratched the surface. The Senior Health Guide includes a full list of medications to review with your doctor, nutrition, exercise, and lifestyle strategies to lower stroke risk, action checklists for appointments, medication safety tips for home. If you're ready to take control of your health, get your copy using the link below this video. And if you want ongoing support, join our Live After 60 community for resources, guidance, and connection.